Hello class, my name is Marianne Saima and this presentation was prepared as part of HAP 709 course Healthcare Databases under the Masters in Health Informatics Program at George Mason University. In this presentation, I will be discussing predicting diabetes with the use of patient data. An estimated 25% of type 2 diabetes mellitus patients in the United States are undiagnosed due to inadequate screening. In addition, population-wide screening for diabetes is currently not cost-effective due to additional time and lab testing required. Currently, diabetes screening risk scores combined with basic demographics and historical information along with laboratory testing is what is being used to predict the future likelihood of developing diabetes. Lab tests often require the patient fasting, patient monitoring, and blood draws. This can be a burden to patients, staff, and clinicians when you apply this method to millions of patients. Electronic health records have shown potential for detecting and monitoring diabetes. Currently, EHRs have been associated with decreasing the rate of emergency department visits for individuals with diabetes. Using a patient's medical history can be helpful in determining the patient's likelihood of developing diabetes. With their EHR, clinicians can examine patients' past diagnoses that may be an indicator of the patient developing diabetes. To test our predictive model, we were given simulated data from a healthcare institution. This data had over 17 million total records and over 800,000 unique patient IDs. An extensive list of diagnoses were used to predict the presence of or risk of diabetes that were observed at least 29 times. Age was also used as a predictor. The range used were ages 40 to 99. Here's part of the code that was used. In order to effectively make a predictive model, diabetes needed to be defined numerically. The following codes were taken from the Agency for Healthcare Quality and Research Clinical Classification Software, or CCS codes, were used to define diabetes. Obvious predictors of diabetes would be any ICD-9 code that has the word insulin in it. More than likely, if the patient needs insulin, is taking insulin, they have diabetes. Another giveaway would be the term diabetic. That's also diabetes. And another giveaway would be peripheral neuropathy. More than likely, if a patient is suffering from that, they have diabetes. In this slide, we have the rare diseases that were associated with diabetes. It's important to note that these are very rare, that if you were diagnosed with one of these, you probably don't have diabetes, but these observations were enough in our patient data that there was a correlation between these diseases and diabetes. On this slide here, we have the important predictors of diabetes. These diagnoses were observed the most amongst the data set that we analyzed. Number 1 was hypertension, and number 10 was congestive heart failure. After I saw what the top 10 diagnoses were, I thought it was interesting that there are a few diagnoses that are very different from each other, yet all of these are risk factors for diabetes. I don't know if anyone else thought that was interesting or if it was just me. Naive's Bayes model can be used to predict the probability of an unknown data set. This model is particularly useful for very large data sets. This model was used to calculate the probability of diabetes. For this project, 20% of data was randomly set aside to check the validity of the predictive model. This is known as cross-validation. 80% of the data was used to calculate what the likelihood ratios would be in this data set, and 20% was used to check the accuracy of our predictions. A receiver operating curve is a plot of test sensitivity as the y-coordinate versus its false positive rate, or 1 minus specificity as the x-coordinate. This is an effective method to determine the performance or quality of diagnostic tests. Each point on the curve represents a sensitivity-specificity pair corresponding to a particular decision threshold. The greater the area is under the receiver operating curve means a more useful test. EHR-based screening for predictive models will greatly benefit the healthcare field. This tool can be used to identify at-risk patients for diabetes and provide them with preventative treatments, as well as have them undergo more formal lab testing. This concludes the end of my presentation. Thank you for your time.